there's a subset of patients with myelodysplastic syndrome that are characterized by hyperactivation of an inflammatory pathway that looks very much like what we see in physiological conditions we refer to as innate immunity. So it's kind of like innate immune response, but it's exacerbated, it's like enhanced in MDS, kind of like an inflammatory type of pathway. And one of the key molecules in this pathway is IRAK. So this is an intermediary between something, for instance, called TOLA receptors and NF-kappa B activation. So we think this is an important target, both in MDS and AML. But particularly in MDS, if we were able to modulate the activity of this particular molecule, this IRAK4, we could maybe tone down the inflammation that we see in low-risk MDS and maybe reset bone marrow function and maybe have these patients make a little bit more blood. And we're excited about this. You know, there are a number of these compounds. There is one by a company called Curis that is more for patients with high-risk disease, acute myelogenous leukemia. And we're working with another compound from a company called Rigel that also studying this, but in the low-risk subset of patients. So we are starting that study. There are a few patients treated, but I think this is a very important pathway, both for low-risk and high-risk disease, but particularly the low-risk patients. It depends. If we see this is an oral compound, for instance, looking at the study, looking at low-risk MDS. If a drug like this, oral, had this kind of effect, improving red cells, platelets, this could be really transformative. But again, my feeling is that at the end of the day, we'll see combination type of approaches. So for instance, one could see a combination with a drug like luspatercept that works through a totally different mechanism with a low-dose IRAK4 inhibitor, maybe controlling what the luspatercept does not control. So this type of a study that I think is going to happen.